Hello and welcome to this group interview with Sakiko Fukuda-Parr, who is Professor of International Affairs at the New School in New York. Sakiko, you've done extensive research on a wide number of topics, including public health, human rights and development, global goal setting, and global governance, and contributed to a range of international policy processes. Now also as Vice Chair of the UN Committee on Development Policy, just to name one. And you also direct the independent panel on global governance for health at the University of Oslo. At the New School, I know you've just set up a new webinar series called Global Pandemics in an Unequal World, where the first webinar yesterday actually was on COVID-19 and global inequality. So at GRIP, we're really interested in precisely these connections between how the pandemic is now impacting on global inequalities. I was wondering if you could start by telling us a bit more about the series that you're running.
Well, thank you very much, first of all, for the opportunity to speak in this series. At the New School, we decided to launch this webinar series on inequality from a global perspective, in part because we felt that so much of the debate, particularly in New York City or the United States, was very Eurocentric and US Eurocentric, and that what was going on in other parts of the world was not really very evident. But at the same time, I was very troubled. I was personally very troubled by the isolationist tone of much of the responses. The first reaction to the virus in many countries has been shut our national borders, and this virus is being seen as an enemy to be kept out, an enemy that originated outside of the country. And of course, there are, people have been very upset by sometimes the racist overtones that has. But I felt that the problem was larger than just, sort of racism. It was really against the idea of a global problem that needed global solutions. So I wanted to contribute to shifting the conversation to this pandemic as being seen something that is very fundamentally a global issue, that where we needed to understand the different ways that this is affecting people's lives in different parts of the world, in different countries, and the different solutions that will be possible, and focus on inequality, because it is very, very clear that this pandemic is exposing all of the inequalities that already exist in this society.
Definitely. We're really looking forward to following your series. I attended the one you had yesterday, and one of the issues that many of the speakers seemed to agree on was the need to start thinking about how we can de-link the logic of health from the logic of the market. So I was wondering if you could say a little bit more about what this might entail in practice.
Yeah, I mean, I think this is very much related to the issue of inequality. One of the panelists, I think it was Mandeep Dhaliwal from UNDP, started by stating very clearly, and I totally agree with her, that this crisis of pandemic comes on top of an ongoing crisis of inequality and as well as the crisis of climate. And given this overlapping, nature of these crises, they are clearly interlinked. That this pandemic is actually affecting people in very unequal ways, right? People talk about things like, oh, we're all in it together. Yes, but we're all in it together, but in very, very different ways. And I think just in terms of simple living conditions and the way that we are able to cope with social distancing, for example, is very, very different. And I personally feel incredibly guilty that I am able to live in an area where I can walk outside very easily, because I don't live in the middle of a city, and I can have my children are already grown. They're, you know, and I think about people who are living in small spaces in much more crowded conditions and so forth, and even at that very local level. But inequalities have been rising, and this is, you know, the crisis of inequality is a structural problem of our age. It's something that has been rising since, you know, since the beginning of the 21st century. It's clearly linked to the neoliberal economic model that we have, and it's creating societies that are very troubling in terms of the capacity to provide equitable opportunities for everybody. The idea that when you have, you know, incomes, such a large proportion of income being captured by the top 1% or the top 0.1%, whose income is going up faster and faster. So, you know, the data from World Economic Inequality Lab, for example, shows that the gaps have been rising. The income share of the bottom 50%, that is majority of the population, you know, is stable or declining, and it's really the top 1.1% and the top 0.1% whose share is increasing. And in that kind of a world, I think you have all kinds of consequences. And that's been documented by, you know, by many people. But, you know, basically, you know, what kind of a social solidarity can you have? How can you pretend to have every child born with the same kind of opportunities for achieving their potential? And we know that that is an economic cost. You know, inequality has economic costs. I mean, for a long time, economists believe that the Kuznets hypothesis of inevitability of inequality rising with economic growth was a sort of a fact. Well, that's been challenged, and we know that inequality can actually be a threat to economic stability and economic growth, and therefore economic prosperity in the world. So the link between health and impact of COVID and inequality, I think, are deeply embedded in the fact that we have already this unequal society. And so I'm sorry to be taking up a bit of time to get to your question about the logic of the market and the logic of health, because it is the logic of the market that is driving this inequality. And health is a quintessentially a public good that does not respond, you know, to the market. That the priorities of the market are not the same as the priorities of public health. And I think there's a difference between thinking about health and thinking about public health as this broader concept that health is a public good, that your health affects my health, and pandemics make that so abundantly clear. So we have to have a logic not only of health, but a logic of public health, and I would say logic of the human right to health.
How do you think that would impact on the responses now in terms of how, like you opened with saying that there's a lot of nationalist response and thinking very much in nation state terms, whether, for example, a universal access to the vaccine that might come at some point, these kind of questions, how we can start thinking about how to ensure that there is actually global and equitable access, and not the US hoarding it for themselves to say.
Yes, exactly. you know, living in New York, I listen, like everybody else, to the daily briefings of the governor, who tells a very clear and a blunt story of what's going on, and the immediate response to this emergency situation with the onslaught of the pandemic was the fear that there would be shortages of hospital beds, shortages of ventilators, you know, and all kinds of medical devices and equipment. And so at the moment we have no vaccines, but we do have gowns and masks and things like that, which are also short supply. And the logic of the market is for everyone to bid each other up. And so the crazy logic of the market has meant that states in the United States are competing against each other in bidding for, in trying to acquire the necessary equipment and so forth. And so, I mean, that's just a clear illustration of some of the things that need to be addressed. But at the more global level, at the broader sort of well, let me just go back a minute and say, so that's that example of the trying to buy up all of these things, I think is not something that has dissipated or disappeared. The need for some sort of coordination and priority setting in the allocation of these scarce resources is quintessentially something that goes against the notion of a free market, right? And then has to require some kind of a public intervention. And that's true at the national level, but it's also true at the international level. And so the logic of public health has to be not only within countries, but I think has to apply to the international level as well. If we jump to issues that are more global, we are going to be investing in the development of vaccines, right? And so who is going to be developing them? Who is going to be able to sell them? Who, at what price? And with what kind of intellectual property protection? And there, I mean, it's extremely worrying that we need international cooperation to make sure that people with less resources would also have access to these vaccines and other treatment.
Definitely. I was also thinking about one of the other points that came up in the very interesting webinar yesterday was in terms of the structural challenges, where it was mentioned that there are now at least 30 African countries that are spending more on debt repayments than they are on healthcare. So I was wondering whether, obviously it's a challenge, but whether there are changes that need to be made to international institutions, not only in terms of finance, obviously, but in terms of global health governance, in line with what you just said.
Well, I haven't, I'm not deeply involved in analyzing structures of global governance in health at the moment in this context. So what I'm about to say, I think, is a sort of just general views, impressions. I think that it's clear that we need structures that that focus on certain kinds of international exchange of information and collaboration. And I think one of the things that I keep on hearing about that has been very positive has been this cooperation among scientists around the world, and the sharing of like genome sequences and things of that kind, and the fact that there has been a great deal of collaboration amongst scientists from Asia, from Africa, from Europe, from the US, and so forth. I think that on these economic issues, I mean, clearly there is a need for international coordination in terms of support to developing countries. And as we heard yesterday, very eloquently described by Winnie Byanyima, the executive director of UNAIDS and former director of Oxfam International, much more progressive debt relief is needed for developing countries. And that really requires action by governments of the creditor countries and the parties that dominate the decision making in organizations like the IMF and the World Bank. And I think that what we know about this crisis is that the effects may be in the first order health, but the larger crisis is an economic one, economic and social, right? And this is where the widening of the disparities is just so problematic, that the economic and social effects affect resource poor countries just as they affect resource poor communities within countries. And so on issues like debt crisis, but frankly, once again, going back to my comments about the access to vaccines and treatment and devices, you need international coordination and policy agreement that takes this public emergency out of the logic of the market, because at the moment the system of financing research and development in the health sector is structured around the institutions of the market, and regulated by the trade agreement, notably the TRIPS agreement. Ironically, of course, the TRIPS agreement enforces patents, which are actually not an instrument of the free market, but rather an instrument of monopoly. But it provides for monopolies for private investment in research and development. So these clearly the institutions that write these rules need more of a voice, need to more of a voice of resource poor countries, developing countries, low income and middle income countries, who are not who are more the who are the debtors as opposed to the creditors, who are more the users of technologies as opposed to the developers and owners of technology. It also needs to have cooperation of the private sector. So there is a broader need for new kinds of multilateral institutions and decision-making processes that favor the voice of the poorer countries, and that also allow for some sort of a consensus and buy-in from the corporations.
Definitely. Thank you so much for that. I think this has been an incredibly insightful interview for us, and we're really grateful that you took the time to speak with us. And I hope we'll continue the conversations going forward, and we're looking forward to
It's been a great pleasure.
Your webinar series. Brilliant.
Thank you very much. It's been a great pleasure to speak with you.
Thank you too.